How good are knee replacement surgeries nowadays? Knee replacement surgeries done for proper indications, that is grade 4 arthritis, deformities of knee joint, osteoarthritis and rheumatoid arthritis do very well. They give excellent pain relief, good range of motion, good mobility and good quality of life. Nowadays, the knee replacement surgery results have improved because of following things. One is minimally invasive technique. Because of improved instrumentation, knee surgery can be carried out through minimally invasive technique. Second thing, the implants are of very high quality and there is inherent range of motion which is excellent in the implant. So patient get very good range of motion after surgery. A robotic knee replacement can give further improvement in the knee joint by cutting perfect knee and giving best results possible. So knee replacement currently has got excellent results and it is recommended in patients who have got grade 4 arthritis, osteoarthritis, rheumatoid arthritis, post-traumatic arthritis. Thank you.